Yeah, I've started the recording. I don't know if it's alerted
Okay.
you from your end.
Yes. Yes.
It has. Nice.
Yeah.
Let me just pull up this and we can start. So, first of all, I'd like to introduce myself.
Okay. Thank you.
Yeah, I am Ogita Austin. I am part of the team that is shooting the documentary of the University of Nairobi achieving 50 years, the pharmacy school that is.
Yeah.
And you're part of the persons that were chosen to uh, give an interview, and I'm glad to
Yes.
have you here. Santi for joining.
Thank you. Thank you.
Yeah, before we start, I'd just like for you to uh, sort of approve that you're okay with us taking visuals and audio for the documentary.
Yes, I am. Although, of course, I would like to see the final version, right?
Definitely,
Like
we'll
before
definitely
it's
send it to
released
you.
anywhere. Yeah.
Sure thing, Dr.
Okay.
Yeah. Uh, then we can just start right away. Let me just start
Yeah.
by asking you to kindly introduce yourself.
Okay. So my name is, okay, everybody knows me as Dr. Atieno Ojo. I do have a first name, Mary,
Mm-hmm.
that I've ended up using out here because it's easier to use it, but I'm known as Atieno Ojo.
Mm.
I'm a pharmacist. I trained at the University of Nairobi
Mm-hmm.
many years ago. I'm sure you'll ask me to answer that question.
Yeah.
But I'm a mother of two adult children so I would consider you like my child
Yeah. Yeah.
in that case, yeah. So I think it's good to start from there.
Mm. Yeah.
Yeah.
When did you train at the University of Nairobi, and what particular memories do you have when you were an undergraduate student back then?
So I trained in 1987
Mm-hmm.
to 1991.
Okay.
Uh, or let's more specifically 1992 because I graduated in 1992 because our graduation was delayed.
Oh.
Yes. So I was part of the group that was called the double intake because we were two intakes at the same time.
Okay.
So we had an 86 group and an 85 group, as you call it. Those who finished high school in 85 and those who finished high school in 86, we went together.
Yeah.
And the reason, of course, was because those days the university used to have a lot of strikes.
Uh,
So the university had been closed for a while.
yeah.
And so we got there as two groups together.
Okay.
And for us in pharmacy, it wasn't such a big deal because the pharmacy class was small.
Mm.
We were less than 30 for a class, so having two groups of that amount wasn't so bad.
Yeah.
Yeah, yeah, we had an advantage. My memories start with the fact that we were a few girls, we were a few ladies,
Yeah.
so majority were men.
Uh-huh.
I think in our class we were 5 ladies,
Out of 30.
5 out of 30,
Yeah.
and one was a foreigner, a foreign student who had come
Okay.
from Cameroon,
Mm-hmm.
if I recall. But we were 5 ladies in the class, so
Mm.
that was already one unique thing, that there were very few ladies
Yeah.
in the class. But otherwise it was fun and interesting. I mean, that's just university life, being involved in student association. There was a pharmacy student association, there was the normal university association, being involved in games and having a slightly fun side of it, which was difficult for being in medical school
Mm-hmm.
because our classes were, I mean, we just had full academic program.
Yeah.
So to find time and space to do something else was a bit challenging, but we still managed.
Mm.
Yeah, we still managed.
Yeah.
Yeah.
Okay. Interesting. I was talking to Professor Jennifer, and she also told us that back then there were very few ladies, but right now ladies are dominating the field.
Yes, yes, yeah, yeah,
Yeah.
yeah,
Uh,
yeah.
you've also served in hospital pharmacy for quite a
Yes,
number of years,
yes,
for several years rather.
yeah.
Could you kindly describe chronologically the evolution of hospital pharmacy practice in the country, and any
So,
landmarks you
yeah.
recall?
Okay, so I was a founding member
Mm-hmm.
of the Hospital Pharmacy Association of Kenya, and so if I take a step back, when I studied pharmacy, of course, we did an all-round course where we did hospital pharmacy practice, we did industrial pharmacy, manufacturing, and also working in retail,
Yeah.
and also in academia. So we were an all-rounder. So during my internship period, I was able to decide for myself, I want to work in hospital pharmacy and probably public health. So I did not want to work in industry and in retail. So I chose the hospital pharmacy line, yeah, at the very beginning. So I had worked at Kisumu District Hospital, then now at Kenyatta National Hospital is when I was asking my pharmacy colleagues if we could form an association and give a profile to hospital pharmacy practice, but also help in pushing for the university to have specialist courses in those areas in hospital pharmacy practice, clinical pharmacy, and the like. So within the Pharmaceutical Society of Kenya, we had a hospital pharmacy wing of it, but then we decided to form an association that was independent of that. So I was among the founding members, and when we started, we started from a very professional approach of having it as a place for learning and for mentoring other pharmacists. So we had annual conferences, we had CPDs, and we had a lot of training and mentoring. And this was an association that covered all pharmacists in hospital, whether it was private sector or public sector. And of course, the association, they also interviewed me, I think, last year, because we're also documenting how far we have come. We had representatives from big Nairobi Hospital, Aga Khan, Gertrude's, then Armed Forces Memorial Hospital. When we started, we were just in Nairobi, because that's what we could handle then. But now the association is much bigger and covering across the country as well. So some of the achievements in having the association, as I said, is of course mentoring young pharmacists, but also bringing those skills back to the society, and then working with the University of Nairobi when I was in Kenyatta to start the clinical pharmacy training, which they started as a master's degree program, you know, using Kenyatta, but also some of the first students were from Kenyatta where I was working, like to go and do the clinical pharmacy training as a master's degree program. So I do think we have quite shaped the hospital pharmacy practice, but also what I call the public health pharmacy practice, which is not just specifically hospital, but working in public sector, which is where I work right now.
Okay. Okay.
Yeah.
Do you think the University of Nairobi, when you are doing your undergraduate, do you think it's adequately prepared you for hospital pharmacy practice?
Yes. As I said, we had an all-rounder kind of training. So we had enough in hospital pharmacy, enough in industrial pharmacy, enough in retail pharmacy. So we had enough to be able to make a decision the path you wanted to take, and the baseline, so that then you could, as I was saying, you could do a master's then to specialize if you wanted to specialize. But there was enough to be able to do that. I would have been happy if they had included some training on drug supply management, because a lot of pharmacy practice involves supplies as well, supply chain and the buying and delivery of medicines, you know. So that was my first training in Kenyatta as in-service training by USID project in Kenyatta, and then we rolled it out as an additional training to pharmacists who are working in hospitals in drug supply management. I'm not sure whether they cover it right now, but I think at some point it was agreed that they will include it in the curriculum.
Okay.
Yeah, that was not there at that time. Yeah.
Apart from hospital pharmacy, or rather in addition to hospital pharmacy, are there any other pharmacy practice sectors that you worked in, and what were your experiences there?
Yes, I have. Like I said, I had a little bit of a stint in industry and I didn't like it. So that's a preference, not because it's not a good practice, but it's a preference. I wanted to work a lot with people, and I felt like that kept me behind the scenes a lot. I have done teaching, so I have done teaching stints at the University of Nairobi itself, at KMTC, And while I'm here, because I'm based in Denmark, I did some teaching at Copenhagen University here with undergraduate students in pharmacy, but also postgraduate students as well.
Okay.
I have done some teaching at Makerere University for short-term courses as well. And I did realize, and a lot of in-service training, so I did realize one of the things I liked was actually teaching.
Yeah.
I've done research, and not necessarily with academia, but also in my area of work. So I've done research and published quite a number of papers in my area of work, where I specialized in public health, but more of pediatric pharmacy, like making better medicines for children.
Okay.
So that's my area of specialization. So I've done quite a lot of research on medicines, medicine formulations, medicine supply for children. My mantra is normally, nobody speaks for children because they're not sitting here with us.
Yeah.
So somebody has to remember to do that for them.
For sure.
I would say in pediatric drug development, especially in the big disease areas, in HIV, in malaria, and in TB, I've been very, very involved in the drug development part. So helping design the drugs, what we call them target product profiles,
Okay.
and then working with industry to develop those drugs, and then with policy to make sure that they're included in guidelines, and with procurement that people can buy them, and with the patients that they can use them. So we've developed some unique formulations of medicines for children that, first of all, make it easier to use, and also make it cheaper
Okay.
to buy. So those are some of the things I'm really proud of when I look back. Yeah. So in a nutshell, I've worked in hospital, I've worked in academia, research, and drug development. So drug development could sound like industry, but for me it's an in-between,
Okay.
like working with designing what's needed for industry to make. Yeah.
Yeah, that's really interesting. First
Yes.
of all, having taught in not only one, but two, but three countries, it's
Yes.
in
Yes.
many fields. So, congratulations, Sana, for that
Thank
is a
you.
lot,
Yeah.
at least in my
Yeah.
eyes. I think you touched a bit on this, but could you kindly summarize what you consider to be your key contributions to the growth and development of the pharmacy training and practice based, let's focus on hospital pharmacy, particularly in the country, rather now in Kenya.
I would expand it a little bit to say public health pharmacy, so hospital pharmacy mainly in public sector, so
Sure.
or public sector practice. So I touched on as I called it, innovation. So I touched on actually using your pharmacy skills to do breakthrough innovations that are actually impacting society. Yeah. So the innovations in doing simulations for formulating. Let me try and make it in layman's language.
Yeah.
So normally medicines for children are given in a liquid form. Small children, because obviously it's a little bit more difficult for them to take the solid forms.
For sure.
But the liquid forms, just think of it, if you buy milk, how long can you keep it?
Yeah.
It has an expiry date that's very short. So normally the liquid forms cannot stay for a very long time, So, and then at that time when I was doing this, many our countries, in developing countries, don't have electricity in every place. They will not have a fridge,
Yeah.
So I was looking to develop medicines that can stay stable, that you can keep for a long time, but it's also easy to use for children, and also easy for the parents, because also if the parents are not literate, to measure the liquid, the exact amount, if I say in Swahili unaambiwa tumia kijiko moja, what spoon is that?
Yeah, for sure. For sure.
How do you measure? So the work we did where I was involved in, because I wasn't the only one, by the way, in this kind of work, it's not solo, you always have a team, was being able to move from the liquids and formulate a solid that you can make a liquid at the time of use, meaning that when you need to use it, you can make that tablet into a liquid
Yeah.
and then use it. So you don't need a fridge, you don't need to measure, accurately the liquid. and it's easy to use. The parent just needs, I know, one tablet or two. I don't have to think I'm measuring 2 mLs, 5 mLs, or something like that. So for me, that's one of the breakthroughs, because when we did it, we started by doing it for HIV, but that process has been modeled for other medicines now, for pneumonia, for malaria, for TB and hepatitis and every other, that it's possible to make a solid that you can make into a liquid at the time of use.
Yeah.
So that's one. The other, of course, is the actual teaching, but also providing direction to where the teaching should focus, so that is impactful to society. Through being in, I'm in working groups and in policy making bodies, sitting in policy making bodies. I have I have authored chapters in books that are also used in training or could be used in training as well. I have some of them here. I don't think if you can see them properly, but this is one of them, which is prescribing medicines for children. As I said, I work a lot in children.
Yeah.
And I have this other one,
Yeah.
which is optimizing drug development, again for children. So we are several authors. I'm just a co-author in the book, but these are used in training across the board, whether it's developing countries or developed countries as well. So curating that knowledge that can make it easier. So my thinking is always to simplify things. As much as pharmacy is very complex, is to simplify it. Yeah, like coming up with that solid form was to simplify it, to say we don't have to make things so complex. We can actually make it simpler and make it work and make it cheaper. And by that extension, I also mentor a number of pharmacists all the time. During when I was in Kenya, it was through internship programs, but now it's on request that I do have a number of pharmacists that normally either they found me on LinkedIn or somewhere, and mentoring them through their careers. And because I'm now sitting at a global level, of course, I'm doing it beyond Kenya, but also Kenyans are benefiting, from that. So this is just a nutshell. There are many things, but this is just like a nutshell. Like I feel like I have made a good contribution, even for Kenya, while I'm sitting at the global level. Yeah.
It's very, you've done quite a large, you have such a large body of work, in the sense that since I was a child, I think all the medicine that we've been using is the parrot gets a bottle with some powder, and you're told to fill water to a certain level, and then shake vigorously, and you use it for a number of days, like 3 days, 5 days. So it's interesting to meet the person who's behind that work.
Yes. But you can do it differently and still make it stable.
Yeah. I've also really liked that point where you say that you make it simple for the common man. It's a concept that I do engineering, so it's a concept that we struggle with, always simplifying the things to make it so easy for everybody to use. So that is quite.
Sometimes we think simplifying will mean we lose our jobs, but it's not. It actually makes our job even more interesting.
For sure.
Yeah, because I do remember when I first brought that concept to the World Health Organization, because I needed to bring it to somebody. They were like, no, this is not possible, and it's not doable. And I said, but why don't we give it a try? Because we already had that type of formulation for adults.
Yeah.
So why don't we give it a try? Let's try it. And I offered to be part of the group that would try it. We do simulations, schemas and those kind of things, and then ask industry to try, and then with a small scale, like pilot studies, until we were able to refine it. And then for HIV, it was so critical, because HIV, the patient has to take at least 3 medicines. So we didn't just make them solid, but we were able to combine the 3 medicines into one.
Oh, interesting.
So instead of 3 bottles of liquid, you're taking 1 tablet.
Yeah.
And since you have to take it for life for a long time, it makes it very simple.
For sure. For sure.
And I had pictures of, I don't have it here, but we had pictures of like a mother carrying a basket of liquids from the hospital. And now you can't even see, it's a small bottle like this that they get for the same basket. So it also saves space and weight and, all these things. And for
Even
shipping.
it's so easy because you can simply forget 1 tablet out of the 3, or
Yes. Oh, yeah,
it
yeah,
simplifies
yeah.
it so much, and
Yes, it does.
that's really beautiful work
Yeah,
you've been doing over the years.
yeah,
Thank you for that.
yeah. And then just to add that from a pharmacy perspective, drug development, it was a challenge for industry because to mix three drugs into one
Yeah,
requires that pharmacy knowledge,
for sure.
and chemistry knowledge to be able to figure out what will work if they interact with each other. They have different dosing levels. How do you decide what's the right level? So we're doing all those schemas. And in malaria, we actually, one of the drugs for malaria, we had to come up with what we call a bi-layered tablet because we could not mix them together.
Mm-hmm.
But you'll put one here, then put a layer in between
Oh, okay.
that is not harmful to a human but protects them from interacting.
Yeah.
But then the patient takes one drug instead of two.
Mm.
So coming up with that, as I'm saying, as part of a team that's working on that, but then the development was done by a university in the UK, one in Germany, and another one in Nigeria.
Mm.
Then putting it together and then taking it back to industry
Yeah.
to then develop it, and now it's the normal thing.
Mm.
Yeah.
Very, very. Uh, it's quite an interesting job you have there, and
Yeah.
it's so powerful what you've been able to do over the years.
Yeah. Yeah.
Yeah. I think we can go to the next question, which will.
Yeah.
I think all of these questions tie to each other in a very nice way. The next question is, what has been the impact of the advent of technology on the hospital, or as you say, public health pharmacy practice, and you in particular?
I consider it a positive impact in the sense that technology can help you do what I call the mundane routine tasks.
Mm-hmm.
For example, being able to count medicine, pill, and label it, So it's separating from the mundane routine tasks and allow you to do the knowledge-based task where it's how you interact with the patient and what you do for the patient. So at that time, that's in the hospital practice directly.
Yeah.
Behind that scene in drug development, also technology is helping in even being able to identify whether this chemical is the right one, that kind of thing. So I think I see it useful. I am a bit concerned about AI now, how we'll adapt to AI, removing what I call the human aspect of interaction. And I'm saying this because, for example, I'm aware there are some countries where now you can go to a dispensing machine, like a cash machine, and get your medicine.
Okay.
Like it's like a cash machine, the way you have a card to go to the bank. So you don't even interact with a human
Yeah.
for that, and I feel like that's something that the patients will be losing in just being able to, and because then the patient will be forced to go back online to figure out
Yeah.
you
How
know,
do I?
what they need and all that. So while I see both sides, benefits and challenges, but it also just means that then we need to adapt in terms of the training and also in terms of our practice,
Yeah.
in how we actually practice, that we need to invite the tools in and decide what can work or not work. In manufacturing, for me, in drug development, it cuts a lot of processes as well. If you have closed systems for manufacturing, it's much shorter and much easier
Yeah.
with technology. That a manufacturing person can sit in front of a computer and can monitor so many things at the same time. If you're in engineering, you know that because with CMC, there's so many controls,
Yeah.
and technology can help with that.
For sure.
Yeah. But it doesn't take away the knowledge to interpret because,
For sure.
somebody needs to be able to see that. So I would say pharmacy needs to adapt, that the technology can take care of as I say, the mundane things. If I go to a pharmacy here and I give my prescription, the pharmacist doesn't even leave me. We sit together and the drug comes through a tube like this and comes to their desk already labeled.
Okay.
And then we have the conversation. So that's the part I'm saying it makes it easier. It makes it easier to do that part.
Yeah.
Yeah.
For sure.
And technology, like now how we are talking, also allows for much more wider base for learning.
Mm.
as
Mhm.
well. Like the students have an opportunity to learn from so many different people in so many different places, so
Yeah.
maybe faster.
Mhm.
Although I'm a believer also in not doing things too fast, there's the human part of just being able to assimilate something.
Mm.
I think so. So it's good to have the platforms, but at the same time, take it the human way. I know with AI we are trying to be superhuman, but I hope that we still remember the humanness is important.
For sure. For sure.
Yeah,
Yeah.
yeah,
Mm. Thank you for that.
yeah.
How has your training and practice impacted society so far? I know you've answered this question before, but in a nutshell, what do you think has been the impact of your practice
Yeah.
and training into the society?
So I think the revolution of going for solid oral dosage forms of medicines for children
Mm-hmm.
has been a great one because, as I said, besides HIV and malaria, it's now being rolled out for other products
Yes.
as well. I'm also working and currently working with what we call drug optimization, where we are looking at drugs that exist
Yeah.
and how we can optimize them. And optimization, as you say, you're an engineer, optimization for us means also like if this drug was designed with 500 milligrams,
Mm-hmm.
can it work with 400 milligrams?
Okay. Yeah. Yeah.
You know, so that requires a few more studies and clinical studies. So I'm part of a group called the Global Accelerator for Pediatric Medicines,
Mm-hmm.
for pediatric formulations called GAP-F, where we look into drug optimization. So we look into, say, we look at drugs in certain disease areas and see can we optimize them. So we are looking at drugs for, right now for cancer, for example, cancer medicines for children, because they are quite expensive
Mm-hmm.
and they're also quite toxic. So if we can work to optimize them and reduce the amount and it still works, for example.
Yeah.
And sometimes you reduce the amount by changing how you synthesize the active ingredient,
Yeah.
or what else you add to it to make it work better.
Mm-hmm.
So that's the pharmacy part. I'm trying to simplify it in human in a bit more basic language. But
Yeah.
how you formulate the drug so you can have the kinetics of the drug and how it works. So I'm in a group that's working on that. And then based on that drug optimization, we have an engagement with industry through what we call an industry liaison forum, where we now share with industry,
Okay.
you know, you can actually improve this by doing it this way. And then we also connect them with the regulation because pharmacy medicines are very regulated. So will the regulator accept your change? We've
Mm.
also worked with regulators to look at pathways, especially for medicines for children, because this is the area I'm saying I'm trying to specialize in.
Mm-hmm.
Because it's not always possible to do clinical trials for medicine in children. So they normally do the trials in adults and then extrapolate to children.
Mm.
So we are looking at innovative ways to also not necessarily study the medicines in children, but work with, including technology, to optimize these drugs and then produce them, you know, and make them. So I think that's one of the impacts. So I think my greatest impact overall is in making better medicines for children across the board, which is the area where I decided to spend my time in. Yeah.
Okay. Uh, that is. Thank you for that. Kindly comment on your national, regional, and international contribution and impact as a UN pharmacy alumni, or rather alumnus. This is also sort of the same question, but uh, what
In another
if you
way,
can
yeah.
just add something to it?
Yeah, I can add, I mean, first of all, by actually being able to get a job and work in the international civil service, because the UN, I work with the UN International Civil Service, it's already a good sign that we have quality training,
Mm-hmm.
that then our skills are transferable. Because pharmacy training is, I mean, the curriculum may not be the same in every country, yeah? But then to be able to learn this kind of jobs in the international civil service, for example, means that the skills are transferable, so that's already a good thing.
Yes.
At the global level, besides the other things I've mentioned, I'm also engaged in doing what we call norms and standards. So things that shape pharmacy practice or drug development or drug use So I would say I'm involved in expert committees with WHO where we develop guidelines for countries, policies and guidelines for industry, standards for how drugs should be made and used, and the like. So I think that's quite something, and that is global, so it's beyond, as you said, beyond my country. So it's for many countries as well. And as I mentioned before, the publications are for everybody, whether it's the books, whether it's the guidelines, whether it is the journal publications. Somebody can find them and use them and read them. So I'm happy that I've done more than just for my country, but also, yes, globally.
Thank you so
Yeah.
much for your impact.
Yeah.
Speaking to you, I hear you've done so many things that have impacted me as a person.
Even me
my
now, I'm listening
siblings.
to myself and I'm like, oh,
Yeah,
I should write a book,
for sure, you should write a book, or you can
yeah,
do a whole
a series.
video course. Yeah,
Yes,
because
yeah,
I
that's
have
true.
friends who are doing such things with the body of work they have now. They're doing video courses for people to at least show what they've
That's a
been
good
doing
idea.
and inspire people.
Yeah, that's a
Yeah,
good idea. That's a really good idea,
because at my level, I'm being inspired by what you've done, and I
Okay.
don't even do pharmacy. But what you,
Okay.
I was doing pharmacy. I'd really want to go after such things.
Yeah,
Yeah.
yeah.
Uh, Now, you've done so much, but what is
Yeah.
one thing that you would have wished to do that impacts training or practice, but thus far you've not managed to do?
I would say this public health pharmacy that I talk about, like the having it as a specialization in Kenya, because in other countries it's there. But having, like, you can have a master's degree in public health pharmacy, you know, as an example, because the way I have ended up there, I did some training in international public health,
Okay.
and then I've had to do bits and pieces of training to put it all together. So for me, I would be like, if I was able to do something, was to have an additional training in this area, because there's so much impact, particularly in our low middle income countries. Majority of healthcare is in public sector,
Yeah.
and it's also where money is limited.
Mm.
And public health approach is always to look at how to serve majority of the people with limited resources. So like this work that I'm doing on simplification and all that, is the whole idea is how can you use the same little amount of money to help more people. So that's something I would be saying even to the University of Nairobi. And I might be able to save myself, I don't know if it's there, but that if they had a master's degree in public health pharmacy, or even drug supply management,
Okay.
like I said earlier, like in public sector, the pharmacy practice, a lot of it involves supply, how to do procurement, and then store it, and then deliver it, you know, that kind. And it requires a different set of skills for those as well.
For sure.
Yeah. I'm interested in the technology and human interface now because of AI. So it's not something I'm wishing I wouldn't have done because it's futuristic. But it's interesting for me to look at how not to lose the the humanistic part of the human
Yeah.
while adopting technology.
Yeah. Yeah.
Yeah. So that's of interest to me.
Okay.
Yeah.
When someone says the name Dr. Mary Atieno Ojoo,
Yes.
what would you like that to? What would that memory? What would you love that memory to be, or rather, what would you like to be remembered for in the pharmacy sector? That is.
So the first thing I would like to be remembered for is innovation, like leading by example, but also breaking barriers, like trying out things and making them work. So I'm not really a conformist. So that idea of challenging something and saying, let's learn from it and let's do something and let's make something better. That's how I've achieved the things that I have achieved. And it's not only in the development of drugs, but also in the career. For example, this public health pharmacy that I'm talking about was an innovation in the sense that I was like, I'm going to try and combine public health and pharmacy
Yeah.
and see how it works, you know. And it turns out to be something that's really very important. And because people are like, why are you doing this and what are you doing for? But I could see it could make sense. But also, if it didn't make sense, I would have tried. So I like to be remembered for being innovative, but also not just innovative, but initiating innovation, like always putting people to be curious. Let me use it that way.
Yeah.
To be curious, to then challenge, and then leading. And then after that, teaching others. So I teach others by actual teaching, but also mentoring and coaching. Yeah. So passing on that knowledge, you know, because there's no monopoly. I cannot do everything.
For sure.
Right? So and then so working with others and teaching others, and then where I can actually building something, like making that drug be available as it is. So I put it in those three areas: the innovation and leadership, and then teaching others through coaching and mentorship and actual teaching, and then actually building. Yeah. And then I would like to be remembered overall for actually making better medicines for children.
For sure.
Yes.
Yeah. Because what you've done, impressive, very impressive.
Yeah.
Yeah.
Making
you so
better
much.
medicines for children. Definitely. Yeah.
Now, so far you've been working in the pharmacy sector, and you know the state of the pharmacy sector so far.
Yeah.
The public health pharmacy sector, that is.
Yeah.
What is your vision for the next 50 years for the same sector, and how do you think this vision can be achieved?
I think my first vision is for people to, what I said, embrace curiosity.
Okay.
Because the world around us itself is changing. So besides technology, the knowledge base for society itself is also now much higher. Like with the literacy levels are getting higher, for example, across the board in many countries. So first is to embrace that curiosity and then update ourselves to address the actual needs of society right now, not stay in the historical needs, because the needs have changed.
Yeah.
The needs have evolved. Yeah. We are in that era where, as I was saying, you can search information and find it. So you may not know exactly what it means, but you could challenge me about it because you can find it. So to embrace that. And the other one for me is to remain patient-centered, because all that we're doing is for somebody. There's a human being, and in this case I say a child somewhere,
Yeah.
who needs my help, whether it is at the hospital level, at the chemist level, at industry in producing something, is to remember that was the original goal, was to help this person. So to think what it takes, and it may take a different channel, because I could see in a few years' time where these professions are integrated,
Yeah.
meaning that the doctor could also be the pharmacist, you know. So there could be an integration of professions or redefining of professions. So just to be willing to evolve and maybe actually lead that evolution, you know, that what is better for the patient? Is it better for the patient now that technology can do this, and then as we focus on this, you know?
Yeah.
And I definitely think going back to that hands-on, the things that technology cannot do, is where we need to focus on. Yeah, we could develop. I mean, in the drug development, there's an opportunity for us to also just stop thinking about the body in parts. You know, maybe you could now develop one pill that treats 5 diseases. You know.
Yeah.
With AI, they can help us model and find things. The one drug can treat 5 diseases instead of one for diabetes, one for hypertension, one for this, but maybe it's one that can treat all of them.
For sure. Yeah.
Yeah, so that's what I see as a way forward, to remain curious and to think beyond the status quo.
Yeah.
You know, break those silos, both from the patient side, but also from the drug development side.
Interesting. Interesting, Sana.
Yeah.
Now, we're coming to the final question.
Yeah.
So, you, as part of the pharmacy alumni from the University of Nairobi, are celebrating the 50-year anniversary this year. So I'd
Yes.
like you to take this opportunity to congratulate your fellow alumni and offer the best wishes to the coming crop of pharmacists from the same university.
So first of all, is just to appreciate the people that decided to start the pharmacy school in Kenya in the first place,
Yeah.
because they gave us that opportunity to actually study pharmacy in Kenya. So if I remember the late Professor Morioki and others those days telling us the story behind how they started after the School of Medicine, then starting the School of Pharmacy. So I really, first of all, want to say thank you to them for doing that, because we would not have had the opportunity, because now there are many pharmacy schools in
Yeah.
Kenya, but this was the only one for a long time. And then to my fellow pharmacists, is just to say, continue in the right path to do the right thing, but remember it is the end user is the patient or our client. That's the one that we are focusing on, like when everything else is happening, to remember that that's where we are focusing on. So I also want to congratulate those that have ventured, because I know people who have ventured into many different fields. I'm not the only one. Like, many people have done great things in the different areas, including in industry and in retail. I'm really impressed now to see retail chains, for example, retail pharmacy chains, where people are handling several pharmacies as one group, you know. So a lot of good things have happened. So I really want to appreciate my pharmacy colleagues. There are a number of pharmacy colleagues I'm aware of that also broke barriers in starting wholesale businesses, which were typically not run by local pharmacists in the past. So just to say congratulations that we made it, we are here. We actually made it.
Yeah.
you know. So, and to the ones that are upcoming, as I said, just embrace curiosity and lifelong learning. Yeah, so that you can continue to make an impact.
Yeah.
Yeah, it's so easy. I mean, I'm sorry to say, with technology, it's so much easier to conform than to be curious, because people are inundated with so much information. There's no time, as I was saying, to assimilate it. Yeah, because to remain curious is, you would not be saying, oh, Gita is telling me this, Mary is telling me this. You're actually questioning whether what he's saying
It's true.
is true, and what can you do with it.
For sure.
So it's similar to, in my, what I think, when we talk about money circulation versus wealth creation. Money circulation is what we are now doing with the technology in terms of circulating information, but not generating new information.
Okay, yeah, that's a nice
So
take.
I feel like we're just circulating information that others have shared, combining them and everything. But what about generating something that's completely new that can help? That's like generating wealth. It's also generating knowledge. So I would encourage the new upcoming pharmacists to also look at that. I'm actually challenging them, like I said, to make these wonder drugs that can treat many diseases at the same time. And that kind of thing. Yeah, and also to make drugs that don't require complex systems, like I said. I keep saying, don't make drugs that require, refrigeration and store at this temperature and the like, and then don't make drugs that require the patient to follow 5 steps to get to make it work.
For sure.
Like, we shouldn't try to make the patient a pharmacist. You can just simplify, take this and put it here. Because like what you're describing, take it, do this, shake, then do this, measure, then this. Those are so many steps.
Yeah.
And if you're a parent and your child is sick, you're so stressed, and you still have to follow those things, it can be very challenging. I'm not just speaking as a parent as well, because I've had to go through it, of walking through that. And by the way, some of the things I was demonstrating to industry was making them do it themselves to see how difficult it is. And then some of them would be saying, oh yeah, I was struggled this with my child, but I didn't think of it. So I'll be telling them, okay, now let's make something better. Now think of that child of yours.
For sure.
Let's make something better and easier. Yeah. So well done to all of us, and we are here. We made it. So the next 50 years, because some of us may not be there, or maybe we could be there because life would make, new drugs would make us live longer.
For sure.
But the next 50 years, we would like to see that fantastic evolution. where all humanity is healthy and able to use safe drugs, because drugs are toxic, they're chemicals.
Yeah,
So we can make them less toxic as well.
for sure.
Yeah.
Yeah. Thank you so much, Daktari.
Wow. Thank you.
It's really all through this work, interviewing the various pharmacists and seeing their impact from
Yeah.
persons who started, as you've said, like Professor Maitai,
My
the
tie,
challenges
yeah,
they
my
went
tie,
through,
yes, yeah.
and all through to the very young pharmacists that I've interacted with, my friends all through the years. It's a noble profession, and you're doing so many big things. So congratulations, Sana, for that, and thank you
Yes.
for offering up your time to communicate and enrich all of us, the
Yes.
people who don't do pharmacy, the pharmacists, and your colleagues, uh, on all the improvements that you've been doing. Asante sana for that. Uh,
Yes, and thank you for taking the time to document this. It's also, as I said, it's also made me think I need to do more to document.
yeah, yeah. If
Yeah,
you're
whether it's
willing,
through those videos or something.
yeah, if you're
Yeah.
willing, we can have a sit down and definitely shoot all of this because you have so much information. You've written books. You've you've done so much, and I'm
Yeah.
sure. I have a friend who does pharmacy. They get
Yeah.
really easily inspired, and these are things that can help a lot.
Right,
Uh,
right, yeah.
so I am one call away. Let me say so,
Okay,
and
I
I'm
can
willing to
follow
help.
up. Yeah,
I'm
can
willing to
follow
help
up.
whenever I
Yeah,
can,
yeah. And
for sure,
thank you so much for taking the time as well.
for sure.
All
Uh,
right.
Thank you so much,
Bye.
Daktari. Have a
Thanks.
good. I think that, yeah. Have a good day.
Okay. Thank you to you too.
Okay.
Bye.
Bye.